This health literacy is about understanding that any patient can have a, regardless of their literacy level. Cal is very well dressed, she looks like a professional woman, I'm going to assume she's well educated, and she's going to understand the term edema or hypoglycemic. She's a big girl, I can tell that. So I make that decision based on how she presents. Now, if she came in looking different, speaking a different language, do I just make the assumption that she doesn't understand those terms? And that's part of the patient education, the health literacy. You approach it. Does anybody remember when back in the day we had an AIDS problem that was presenting in the hospitals, and we talked about universal precautions? And that was that treat everybody as if you have to protect yourself against the bodily fluids. Any bodily fluids have to be protected. So you treat all patients in that sense. There's a potential HIV case that I can be handling. The Health Literacy Project talks about patient education being part of this universal acceptance or understanding or idea that all people may have low health literacy regardless of what their socioeconomic status is, their profession, their race, creed, color, age, etc. You make the assumption that I try to speak to Kala or anyone in language that I think they're going to understand. Don't use the term hypoglycemic when you mean something else, or you can say it in a different way. In the patient education curriculum, we do examples with the class where I'll give you a series of words and you'll try to translate them into something that someone who has no healthcare background in terms of clinic or caring would understand. And so you make the assumption that any patient can have a low health literacy level regardless of who they are. So you go to a lower common denominator. What's the problem with that? Nothing, basically, if you're getting to improve the communication with the patient. So the patient understands why you're treating them, what they're expected to do, and they can teach it back to you. All these are parts of the complete patient education curriculum.